Hi, I'm Peter Harris. I'm Director of the Polycystic Kidney Disease Centre at Mayo Clinic and also a member of the work group associated with the KDIGO 2025 Clinical Practice Guidelines for the Evaluation, Management and Treatment of ADPKD. Specifically, I oversaw the chapter associated with Nomenclature, Diagnosis, Prognosis and Prevalence of ADPKD, and I'm here to share some key takeaways with you. So what is ADPKD? ADPKD is defined as a group of dominantly inherited disorders associated with kidney cysts and extrarenal manifestations and caused by a pathogenic change in a gene associated with this disease. The disease is usually progressive, manifesting clinically in adulthood and often resulting in kidney failure. So how do we diagnose ADPKD? The guidelines stipulate in an at-risk individual, usually one with an affected parent, that abdominal ultrasound should be initially employed. Previously, age-specific numbers for cysts seen on ultrasound have been described to diagnose and exclude ADPKD. That isn't to say that MRI or CT and sometimes genetic testing can also be useful for diagnostics. We've developed a diagnostic algorithm showing the steps to take to diagnose ADPKD in at-risk individuals, and this highlights the importance of ultrasound, but also shows the other imaging and genetic analysis can be helpful to obtain a firm diagnosis. What about a role for genetic testing in ADPKD? Although often not required to make an initial diagnosis of ADPKD in a person with a typical presentation, genetic testing can be informative with people with an uncertain diagnosis based on kidney imaging and can aid obtaining a definitive diagnosis in them with those with a negative family history or unknown family history. Because of heterogeneity in the genetic causes of ADPKD, genetic testing should screen a panel of known ADPKD genes, not just PKD1 and PKD2. So how can we identify patients with more severe disease where treatment is indicated? Although there's no complete consensus with some regional variability, where imaging is available to assess the height-adjusted total kidney volume with the age, the Mayo imaging classification is recommended. This is the most straightforward way to identify patients with rapidly progressive disease. Another classification system that is of prognostic value is the predicting renal outcomes in polycystic kidney disease, ProPKD, and this employs genetics, sex and clinical factors, and is especially useful if quantitative imaging is not available. The next point is about the nomenclature of the disease. And we recommend using a common nomenclature of the disease name followed by the gene name, for example, ADPKD, PKD1, when diagnosing an individual with genetic data available. This nomenclature uses the disease name that patients and nephrologists are familiar with, but adds the gene name, which provides more specific details of the disease in the affected individual. We recommend a similar nomenclature for the autosomal dominant polycystic liver disease. An example here would be ADPLD SEC63. In a person with incidentally detected kidney or liver cysts, detailed clinical and imaging assessment and genetic testing can help attain a firm diagnosis. Again, we've developed a diagnostic algorithm to provide a step-by-step approach how to proceed under a variety of circumstances. So let's next address disease progression. We have identified a range of clinical, genetic, lifestyle, environmental, and chance factors which are thought to influence the rate of disease progression in ADPKD. The guidelines illustrate in a figure the range of different factors thought to influence disease development and how these may manifest. So there's a number of things that we need to consider when we're doing testing for ADPKD by imaging or genetics. And most importantly, we need a patient-centered approach that prioritizes the patient's values and preferences and understand that there may be negative as well as positive outcomes from this testing. Now let's think about ADPKD prevalence. ADPKD is the most prevalent monogenic kidney disease associated with kidney failure, accounting for 5 to 10% of individuals worldwide with kidney failure, those requiring kidney transplant or dialysis. ADPKD affects all populations with generally no common pathogenic variant enriched in a particular geographic area or racial or ethnic group. So this concludes our focus on the nomenclature, diagnosis, prognosis, and prevalence of ADPKD. Thank you for watching. I encourage you to explore the entire collection of videos we've assembled about this guideline. The guideline represents significant effort from a dedicated team, and we hope it meaningfully supports both ADPKD clinicians and the individuals around the world with this disorder. The full clinical practice guidelines can be accessed online at www.kdigo.org.